More than a dozen people in the UK have been tested for coronavirus, as the Health Secretary said there is an increased likelihood of cases occurring. 14 people were tested for the virus, with 5 confirmed negative and 9 still awaiting results, Public Health England, PHE, said on Thursday night. The Scottish Government had earlier confirmed that 5 people were being examined after presenting with symptoms of the illness, while it was understood that another patient was being tested at Belfast's Royal Victoria Hospital. PHE would not give a breakdown of whether people were tested and whether negative results were recorded. While none of the UK cases has been confirmed as the virus so far, 2 of those being tested in Scotland had been diagnosed with influenza after travelling to Wuhan, China. They all travelled to Scotland from Wuhan, where the outbreak is thought to have originated, within the past 2 weeks, and were showing symptoms of respiratory trouble, a red flag for the virus. Downing Street said 4 suspected cases in Scotland were believed to involve Chinese nationals. It comes after infections expert Professor Jürgen Haas claimed there would likely be many more cases around the country, while Health Secretary Matt Hancock said the NHS is ready to respond appropriately to any cases that emerge in the UK. In a statement to the Commons on Thursday, Mr. Hancock said while there is an increased likelihood that cases may arise in this country, we are well prepared and well equipped to deal with them. Also on Thursday, the World Health Organization, WHO, said it is too early to declare an international public health emergency over the outbreak given its restrictive and binary nature. Speaking at a press conference, Dr. Tedros Adhanom Ghebreyesus, Director General of the WHO, said, "Make no mistake, this is though an emergency in China. But it has not yet become a global health emergency. It may yet become one." He said 584 cases have been reported to the WHO, including 17 deaths, with 575 of the overall cases and all the deaths reported in China. Other cases have been reported in Japan, South Korea, Singapore, Thailand, the US and Vietnam. Dr. Tedros said, "We know that most of those who have died had underlying health conditions such as hypertension, diabetes or cardiovascular disease, that weakened their immune systems. We know that there is human-to-human transmission in China, but for now it appears limited to family groups and health workers caring for infected patients. At this time, there is no evidence of human-to-human transmission outside China, but that doesn't mean it won't happen. There is still a lot we don't know. We don't know the source of this virus, we don't understand how easily it spreads and we don't fully understand it. For more on this story, visit the news article link.